HLN is a HIT consulting company. We focus on services, not on products. We've been around almost 30 years now, and we operate almost completely in the public health space, which is a little different. We both work on strategy projects, but also we have folks who spend a lot of time just rolling up their sleeves and slogging through the work in the trenches to make a health IT a reality. Yeah, this is a really challenging time. It was challenging before the pandemic really stressed public health and stressed public health information technology. In a very short time, public health had to deal with a lot of new data challenges and new systems challenges. Sometimes their systems held up and sometimes they didn't. We're now a number of years past that and trying to think about what the next set of issues might be coming forward. Systems have gotten old. Most of the core systems in use in public health have been around for 20 years more. Their technologies are aging. The skills that are required to maintain them are harder and harder to acquire. So agencies really need to modernize their systems. There's an initiative that's called DMI, the Data Modernization Initiative. But really, that's almost a misnomer. It came from the way Congress named it, but it's really a system modernization initiative. And it really requires agencies to look at the systems that they have, figure out what's working and what isn't. And it's going to take years for them to try to rebuild and build systems to be able to be cloud-based and services-based and modular in ways that will allow them to be sustainable, which is really the second thing, that they need to be sustainable moving forward. We're in a period now of extremely unreliable funding for public health, both because there was a huge spike in funding during the pandemic that now is waning away, and a new administration that hasn't quite figured out how it wants to fund public health moving forward. Agencies, like a lot of organizations, have to stop thinking about their investments in systems as sort of a one-and-done thing. Yes. And we're now in an environment essentially of continuous development and continuous improvement, in part because the challenges, especially in public health, are ever-changing. And the world doesn't stand still, the threats don't stand still, and hopefully the opportunities don't stand still either. Yeah.